Hi, this is Jen with Spirit of Health. Thanks so much for following us along on our journey with our third pregnancy. We've been having a lot of just fun shooting these videos and getting information out to you, and just hopefully inviting you into the journey that we've experienced, and encouraging you on your journey for your present children, and hopefully for your future children as well. So today what I wanted to talk about were the common medical interventions that we often see used in hospital births. And so I wanted to talk about the dangers of those, but then also talk about the ways that you can hopefully navigate those naturally, and things that can promote you not needing those. So first thing first, we've said it a lot of times, but interventions all became necessary at some point, and they were introduced usually to help save the life of a child or save the life of a mother. And we absolutely value that, and that should never be devalued. And if that's something that you've experienced, whether by cesarean or induction, and it was for good reason, then we don't want to put any kind of negative connotation on that. But unfortunately, what we're seeing right now is we're seeing that there's rates that are so high in the hospitals of cesarean and inductions and epidurals that we know that these interventions are being used across a large population of healthy women that may not have necessarily needed these interventions. And because they were chosen that, whether knowingly or unknowingly, they were subject to the risks of those. So we always want the ultimate purpose of choosing that intervention to outweigh the risk. But unfortunately, what we're seeing today is a lot of choices to use interventions that have much higher risk than necessary, should have been taken. So first thing that I kind of want to talk about before we get into all the dangers of some of these interventions would be just ways naturally to help the body get into a proper place for a natural birth. So we talked about this a little bit in our last couple videos. We talked about exercise and how critical it is, and we talked about diet, and that is just so true. We can't emphasize that enough. We really believe that the proper diet is going to give the body the stamina that it needs to sustain the process of labor and delivery. It's an incredible experience, and the body needs all the nutrition that it can get. And the uterus is actually a muscle, but it's not really under voluntary control. It's actually just it's monitored by this kind of what I would like to call maybe the subconscious, but it's an autonomic nervous system reflex that happens based on hormonal control. So it needs to contract and relax based upon the nutrients provided to it. So the body going into labor needs to be a healthy body to supply the needs for that process. Number 2 is exercise. Physical exercise for all the other muscles that actually are voluntary, because the legs, the arms, all of those things get involved in getting the mom to position to really open the pelvis and hold your body in different positions to really take the pressure off of where the baby might be on the pelvis, and work through the contractions and work through the progress of the baby through the pelvis. So those muscles are critical, and they're very important. And fatigue is commonly one of the main reasons that we see women go into a place of having to decide for an intervention, because they're just so tired. So exercise and nutrition, we'll just keep saying that over and over, is so important to set the stage for that in the first, second, and obviously staying with it in the third trimester. There's a resource that we've talked about a little bit, and I just want to continue to highlight it. It's called spinningbabies.com. It's been a blessing to us and to many other women that I've talked to, and a lot of midwives recommend looking into it. It's just got a lot of great resources for ways to position the body and open the body's pelvis before you go into labor, during your pregnancy, but then additionally, even during labor, to help the baby move through the different stages of the pelvis so that the baby can come out properly. And I think just understanding some of these natural ways that we can assist the birth process is so important, because otherwise we may feel kind of a pressure to work into an intervention when maybe we just needed to do some relaxation positions or different stretching to help open up the pelvis. So I think that, if we have that mindset that we can trust the process, there really becomes an empowerment to the mom. And that's really our goal with these videos, is we really want to empower women to trust the process. And we've had 2 pregnancy and deliveries so far, and both were so different. And our first was the classic contractions on top of each other until we had a baby. And we kind of, I think first-time parents assumed that our second labor would be just like that, and it wasn't. It was contractions and then no contractions, and then contractions and then no contractions, and we kept waiting for it to really take off. And what we learned was that the baby was just getting into proper alignment, proper positioning to come down into the birth canal and to really get through the pelvis in a proper way. That a lot of women talk about back labor and posterior babies and how painful they can be, and it is true that there's an ideal way for the baby to come through the pelvis. So if we can understand that there might be some ebbs and flows and that not all labors look the same, then we can start really asking our body what's happening inside, and we can partner with the process. Unfortunately, a lot of times when you get into the hospital setting, you start kind of getting like a cookie cutter approach. And unfortunately, not all labors are cookie cutter, and they don't all take off the same way. And you start getting put on what they call the clock. And so, unfortunately, this is the reason we feel that a lot of these interventions are being used, is to expedite the process that may not be ready to be expedited. So what is the most common way that we expedite labor? Is induction. And there's a couple things that I want to talk about. One is synthetic prostaglandins, and the other is synthetic oxytocin. So prostaglandins are a natural hormone that the body uses to thin the cervix, or what they call ripen the cervix. And fortunately, God's given us a couple great ways to do that. Evening primrose oil is something you can start taking at 36 weeks. And then, amazingly, semen. So the whole reason you're pregnant anyway, right? And so, intercourse, sex, those are things that can help ripen the cervix leading up to labor and delivery. And unfortunately, there's some synthetic prostaglandins being used to help the cervix ripen, so to speak. But because they're synthetic, they're very strong in the body, and they have major side effects. And unfortunately, they're associated with uterine ruptures, extreme bleeding after birth, so postpartum bleeding that's just exacerbated and very excessive, and unfortunately, even rates of death. And this is amazing to me that they're still doing this, that these are statistics that I'm reading that are not just made up. These are real lives, real people who have experienced this. And so the death is usually related to some type of embolism that happens where some of the amniotic fluid gets into the mother's system, whether it's the blood, and it gets into the heart or the lungs, and can cause an embolism. And this is fatal. So, choosing a synthetic prostaglandin is a big deal to me, because it oftentimes, in my opinion, it's not necessary. And there's some really good natural ways to use God's given things to ripen the cervix. So the second category that I wanted to talk about today was the synthetic oxytocin, most commonly known as Pitocin. And this is just the rage right now. I mean, it's really rare to hear of a mom who's been in a hospital and wasn't either given the option or took the option to use Pitocin to expedite labor. Basically, it's a synthetic form of oxytocin, which is a natural hormone that your body would create. But in the synthetic form, the body is releasing basically high amounts of this hormone to cause uterine contractions. So that might sound great. You want to get the labor over with, but what's most affiliated with the use of Pitocin is painful labors, extremely, extremely painful labors. And there's a couple reasons why these labors become so intense. and painful is, number one, oxytocin is a hormone that's used to create those contractions, but at the same time, when it's naturally released in the body naturally also releases other endorphins that help with pain relief. So in a natural birth, the mom's experiencing levels of oxytocin for contracting the uterus, but at the same time, you're getting the benefit of the pain reducers or the pain relievers that are naturally created in the body. And so they partner with each other, and it helps birth become more of a bearable process. And so I can tell you from having gone through it twice, it's not the most pleasurable thing. It definitely can be painful, but it's tolerable, and it's within the norm of what a human body can handle. But the synthetic forms are going to be much higher contractions, and they're not going to be accompanied by the natural hormones that would bring pain relief. And then the second reason that the birth process with a Pitocin would be so incredibly painful would be that the baby may not be actually in the right position yet to come through the pelvis. So we're choosing to go ahead and induce labor, but maybe the reason that the labor isn't progressing is that the baby's still not ready in proper position to come down through the pelvis. And so really we need to respect that. And like I said before, we can sometimes see these ebbs and flows in labor, and the baby's just working, and the uterus is working, and the body's working. And it's really wise to just trust the body, unless there's something going on where the midwife's seeing some really serious signs with the baby. You know, I really encourage you to just allow that process to evolve naturally and see what God has in store. So we talked about how this is so painful that the body is just going through all these heavy contractions and the baby's being forced to come through the pelvis. Well, what's the next kind of cascade that happens is usually women at that point really need some type of pain management for good reason. They're in intolerable pain. So the most common form of pain management that women are offered in the hospitals is epidurals. And you know, we all know epidurals are an analgesic, and it can relax the body, and in some cases it's just enough to relax the body that the pelvis can open up and the baby can come out. But actually, statistically speaking, if you look at the rates of cesarean related to epidurals actually increase your rates of cesarean much higher, because there's a yo-yo effect that happens. So the Pitocin is increasing the uterine contractions. The epidural is decreasing the uterine contractions and causing things to kind of relax and almost numb the body. And there's kind of this intermixing, what I like to call like a yo-yo labor. The body is trying to figure out what all these synthetic drugs coming into the body are telling it to do. And ultimately, usually this is when a labor goes into a stall pattern that is beyond the body's ability to recover. So, you know, using an epidural is not always the inevitable cesarean, but unfortunately, a lot of times it does result in them. There's also a lot of risks with epidurals that we may not really be fully aware of. I think sometimes we hear a word so common in our society, we kind of get numb to that. We start talking about it as if it's just normal, and we forget the whole other side of the coin. And so today, I kind of want to end this video just talking a little bit more clarity about epidurals, because to me, this is it's a real heart of mine to empower women with choice and knowing the full story. So there's a couple of things that I want to talk about. I want to talk about how epidurals affect the birth process, how epidurals affect the mother, and lastly, how epidurals affect the baby. So when an epidural is given, it's not just, first of all, it's not just an analgesic. In fact, if you go deeper and you look at what's really being happening in the hospital, they're actually giving like a cocktail. And so this cocktail is going to come with not only the analgesic, but it's going to come with opioids, and it's going to come with narcotics. And the reason why is because they can't just give the body one type of pain management, because it'd be too high a risk of having a reaction or an overdose. And so it's the same reason we don't do cocaine when we're pregnant. We don't want to introduce some kind of high level of narcotic into the system that would affect us or the baby. And so, unfortunately, we're being given that right in this vital time that we're giving birth to our baby. So, during the birth process, these narcotics, these analgesics come into the body, and they can cause the body to just, well, the purpose is to numb the body. But what happens with that is the body goes into kind of a numb state. The mother often doesn't know when a contraction's coming. She's not able to position properly. So then the baby starts getting into a position that maybe isn't ideal because the mother isn't ready to change a position, or she doesn't feel the pressure that would feel normally off or awkward, and she doesn't have the sensations to respond to that. So you often see high rates of massive perineal tears. You have lots of pelvic floor damage because there's not a lot of feedback happening between mother and her body. So unfortunately, the birth process can be very traumatic for the mother's body, where you see, just all these complications arise where forceps are now needed, or a vacuum is now needed. And so the birth process just goes from, Pitocin to an epidural to a forceps, and all of a sudden, she had hoped for a natural labor, and she's now used 4 or 5 different interventions just to get the baby to come out. So then I wanted to talk about some of the things how epidurals relate to the mom. So we know that it's an analgesic and it has these other narcotics coming in, but one of the effects of these pain medications is a rapid drop in the mother's blood pressure. And this is very dangerous for the mom. And oftentimes, if it can't recover on its own, another drug is given. So we're just introducing more and more things into the mother's body that are not necessary. There's also a high risk for, spinal fluid to leak out and cause a headache in the mother. And the worst case scenario for the mom would be having a permanent nerve damage. And unfortunately, we don't like to think about an epidural causing paralysis, but it's really true. And in fact, when Vaughn and I did our Bradley method class with our very first pregnancy, we were actually able to meet a couple who had had that happen within their circle of friends. And that was really sad to hear, that this mother was now in a wheelchair because of an epidural. So it is rare, but it does happen. And so we have to be real about these dangers and these potential side effects. And lastly, I want to talk about the baby. We all want the baby to be healthy, and that's our goal. So how are these drugs affecting the baby? And number one thing to understand about the baby is that their liver's not functioning right now. When the baby comes out, it can take, on average, 3 to 4 days for that liver to really start functioning. And that's why a lot of times babies can be born jaundiced. And it takes a few days for their body to start to really utilize their liver in a proper way. So imagine the mother gets all of those drugs, they go into her bloodstream, they get it through the umbilical cord, they get to the baby, and now the baby is delivered. And the baby now has to deal with the remainder of all of those drugs in its own system without a functioning liver. This is not ideal for the baby's first few days of life. And it's just really setting up the baby for just not a healthy first week. And so you're going to see oftentimes a baby that's born through an epidural is going to be kind of on the unresponsive side. So it's not going to be as alert. It's not going to have that vital energy that's flowing through it. It's not going to be, it could potentially have some breathing disorders, and then it also is going to affect the mother and baby's latch when they're trying to create that breastfeeding relationship. So, and of course the host of the gamut of what narcotics do to the body. So, this is a lot of information, but overall, I really encourage you to do your research. Make a birth plan that feels right for you, and really get the full picture. And when we're faced with decisions of interventions, we always want to outweigh what is going to be the most beneficial for the child. And so I know pain is a big motivating factor for women to sometimes even voluntarily choose epidurals way before they've even started their labor. But if we have the big picture, hopefully this will let you choose to go through with this, the way God designed it to be. And God will empower you with natural things within the whole dynamic of the labor and delivery. God has designed the body in certain ways to recover and recuperate naturally to ultimately deliver a healthy baby. So thank you so much for watching this video. Our heart behind this is really just to empower women to hear the full story and to give them the tools that they would need to walk through a natural birth. Because ultimately, we really believe that, fear is often what drives us away from God's design. And we don't need to live in fear, because God's given us everything we need to live a healthy life and to bring forth healthy children. So bless you, bless your family and your future children.